I would like to have your advice on a very particular case. Recently, a young lady came to me in practice, a 36-year-old lady, complaining of back pain. Lumbar pain, thoracic pain, cervical pain, but mostly lumbar pain. And she tells me that she is a back patient since many years, and she says she has polyarthritis. She also says in the same sentence, I have fibromyalgia and I have polyneuropathia. Well, that's already quite impressive. She quit working a few months ago. She used to work in a coffee bar. In the meantime, she has more back pain. Painkillers don't help her too much. Because of other medical reasons, she cannot take non-steroid inflammatory drugs. About 4 months ago, she got her first baby. But what is the main problem? Well, it seems to be the lumbar problem, and she describes pain, low lumbar spine, central, and a little bit on the left side. She doesn't seem to have radiation of pain, so no radiation in the buttock or in the legs. And when I ask her if it's easy for her to lie in prone lying, then she says, it's already since years I can't lie on my abdomen anymore. And during the night, when I have to turn from one side to the other side, this is really a huge task that takes several minutes with a lot of effort. She has to sit first and then stand and sit again and turn to the other side. So it's a quite impressive story. On top of that, she also says that her right leg, and she shows it to me, is a little bit shorter than the other leg, and that this misalignment, because she learned the word misalignment from another physio who told her that 15 years ago, and since those 15 years she's really convinced that this misalignment brings her out of balance. What happens when she coughs or sneezes? Then sometimes she gets more back pain. When I ask her how the transition goes sitting, standing, so the curve reversal, that's also quite dramatic. In the past, she also got a gastric bypass, and the last thing she told me, remember, it's a 36-year-old lady, and she told me, I have the skeleton of an 80-year-old woman. When I do functional testing, lumbar spine movement in standing, in lying, I don't find too much which is worrying. The range of motion is pretty okay. It's more than pretty okay, in fact. There is a big contrast between, on the one hand, her story, which is really, let's be honest, is really a drama story, and what I find in the functional examination is something totally different. So I think in that case there is really a big component of central sensitization. But my question to you is, how would you further deal with that patient? What would you do? Well, during the first visit, I tried a little bit to de-dramatize things with respect for her problem, with respect for her feelings. And I took one element from her history, the element of the 15 years of misalignment, and I tried to explain her in a friendly way that this misalignment could be quite asymptomatic, that this is rather normal than abnormal. But I felt I had to do it in a very gentle, in a very quiet way, because she's so convinced in her head of the whole stuff, polyarthritis, polyneuropathia, fibromyalgia, everything. So I'm going to do it step by step. But I'm curious, can you give me any suggestions? How would you deal with this patient? Just let me know in the reactions below this film. Okay? Thanks. Bye-bye.